Hey, it's Logan again. Thank you for tuning into our channel. Today we're going to be talking, like we always talk, about back pain with pregnancy. And we're providing taping techniques that's going to help support the stomach so it's not hurting the back. It's going to help with that back pain with pregnancy. First thing we're going to do is I'm going to teach Brittany how to tape it. And then if you pay attention at the end, we're also going to show Brittany taping herself, which shows you how easy it is. And if you stay at the very end, we're going to have a special prize for you where I'm going to give you a discount on purchasing pregnancy tape or some of our other products as well. First, as always, I'm going to go ahead Okay, so here's, this is another taping technique where we're going to be still showing the support for the bottom of the stomach, but then also showing support for the sides of the stomach as well. So the first step that that's going to be is we're going to be measuring from the side here and taping underneath the base of the stomach like this, all the way around. That's going to give us our first measurement. Simply cut the tape just like that. Then after that, there's going to be the base of the anchor that's going to be at the two SI joints, which where the hip bones are at. So right here and right here. So what I'm going to do there is I'm going to take a measurement as well, measure from where the SI joint's at, and I'm going to measure the side of her stomach, just like such. It's roughly going to be around the same size for both sides. So the benefit of that, I'm going to just take the tape, lining it up against another piece of roll of tape, like this, and cutting that. Now, as we do in a lot of our other videos, is we show that you should always round the corners. The reason why we're rounding the corners, see these little pesky corner tips right here? If they're not rounded, what's going to happen is you're going to get caught on your clothing, and then you're going to end up losing the tape because it's going to come off quicker than it should. The tape should last about 5 to 7 days, can remain on during the pool, can remain on during showers, going to the beach, vacations, sport activities. You can sweat in it, it's perfectly fine. You can keep it on. Perfect. Round that out. Let's go ahead and round out the other side as well. So now that I've rounded them all out, you see they're perfectly round. You fold this, the main one, directly in half. Then you crease it like such, so that I can then, when I flip it over, know where that's at. See the little line right there. Now I'm simply just going to like this, simple tear, like such. Now I'm going to be pulling back the tape, roughly about 1 inch. This is going to become our anchor at the base of the stomach right here. Again, another roughly 1 inch right here. Remember not to touch the tape because it's pretty sticky and you don't want to ruin the adhesive. Okay, so now that I've done that, I'm looking for the base of the stomach. Just turn this way right here. Looking for the base of the stomach, which would be right here. We're going to simply just apply that like such. I'm going to rub my hand on it to activate the adhesive. The warm rubbing will get the glue to stick. Now that it's there, all right, now I'm going to take this finger, my left hand, if it's me, if it's your spouse or anyone else is doing this for you, put this here. I'm going to use this hand to pull off the tape. Just like our other taping technique videos, we're only doing 10% tension, which is, coincidentally, just taking the tape off. Just like such. And if this excess tape is going beyond the back, it's perfectly fine. Perfect. And just simply just rub that to activate the adhesive. You can use your hand or the tape. You've seen different videos of mine. I use different techniques. It's perfectly fine. Either one, it's whatever really where fits your interest, what you're looking to do. Again, taking the opposite hand, putting it behind, and then just rolling with it as she's going to turn with me. Turn that way. And there you go. Perfect. So now you have the full support of the stomach. Okay? Now that's in there, she's got bottom support. Now what we're going to do is we're going to show support for the sides of the stomach as well. And the first thing we're going to do is we're going to create our anchor. I'm going to roughly fold in about 1 inch. No one's exactly measuring it, so you can kind of eyeball it. Crease it again like I said before. You rip it. Just like that. Pull it off. Make sure not to touch it. And when you're doing that, now this is going to be the part that gets no tension at all. Okay. Now we're looking for the SI, which is right here. Okay. I'm going to pull this back just a little bit. Okay. and just place this right in there. Rub it to activate the adhesive. Once the adhesive is activated, put my thumb right there, pull back the tape. Again, no main tension, just be tape off tension, which is just so the tape coming off the paper. Perfect. Just like that. Now rub it to activate the adhesive. Okay. Look, it matches our outfit. Okay, other side, again another inch, just like such. I'm gonna rip it. Pull off the tape. Okay, searching for the SI joint again, which is right here. You simply just pull this back, rub in the anchor, and then I'm going to just simply place my finger behind it, pulling it straight up. If the tape's going to overlap a little bit, just kind of get it to go just before it so it doesn't overlap on top of it. And then simply rub that in. And we're good to go. How does that feel?
Good.
Good. Perfect. Hey, thanks for watching our video. If you're interested in learning more tips and tricks on how to help with back pain during pregnancy, make sure you hit the subscribe button to be alerted when we come out with new videos. In addition, if you're looking for more information right now, click this next video here.